Welcome to our channel Applied Veterinary Medicine. Today, we're diving into the topic of coccidiosis, a significant disease affecting livestock. We'll cover its causes, transmission, risk factors, signs, treatment, and prevention. Let's get started. Etiology. What causes coccidiosis? It's a parasitic infection caused by protozoa from the genus Eimeria and Isospora. Different species affect different animals. In cattle, E. zerni, E. bovis, E. ellipsoidalis. In sheep, E. arloingi, E. crandulus, E. arzata. In goats, E. arloingi, E. capruvina, E. christenseni. In pigs, Isospora sui. In horses, E. liacati, though it's not clinically significant. Transmission. How does it spread? Infected animals pass oocysts in their feces, which contaminate feed, water, and even their hair coats. Animals get infected by ingesting these sporulated oocysts. Environmental conditions play a huge role in sporulation. For instance, cool, moist conditions favor sporulation. Dry heat and sunlight destroy oocysts within weeks. Risk factors. Which animals are at risk? Young livestock are the most vulnerable, especially under poor nutrition, overcrowding, or stress. Environmental factors like overcrowding, poor hygiene, contaminated feed or water, and irrigated pastures significantly increase infection pressure. Pathogenesis. What happens inside the animal? Once ingested, sporulated oocysts release sporozoites that invade intestinal cells. This causes cell destruction, bloody diarrhea, and impaired digestion. Clinical signs. Here's what to look for. Acute symptoms: diarrhea, often bloody, weight loss, dehydration, and weakness. Chronic symptoms: reduced growth and poor feed efficiency. Diagnosis. Coccidiosis is diagnosed by examining feces for oocysts, along with the animal's history and clinical signs. Treatment. Let's discuss how to treat coccidiosis, a disease that is usually self-limiting in nature. Did you know that spontaneous recovery often occurs once the early stages of the parasite's life cycle are complete? However, treatments are crucial in preventing outbreaks and managing severe cases. Treatment limitations. It's important to note that most chemotherapeutic agents are effective only during the early schizogony, merigony stages. They have little to no impact on the later gametogony stages of the parasite. Managing an outbreak. During an outbreak, the following steps can help. Isolate infected animals immediately. Provide supportive therapy, such as oral or parenteral fluids. Reduce overcrowding by decreasing pen densities. Elevate feed and water supplies to avoid fecal contamination. Mass medicate feed and water if needed to minimize new cases. Special care for cattle with nervous signs. Cattle exhibiting nervous signs should be brought indoors, kept warm, and provided supportive therapies. Despite these efforts, the case fatality rate in bovine coccidiosis remains high. Specific treatments, medications, sulfonamides, amprolium, monensin, and lasolocid are commonly used. Calves and lambs, sulfonamides like sulfadamidine are commonly used. For example, 140 mg per kilogram body weight for 3 days is a standard protocol. Amprolium is another popular choice. It not only treats but also improves weight gains and feed consumption. Piglets. For piglets, symmetric triazinotrians are highly effective if administered before clinical signs appear. They target both the asexual and sexual stages of Isospora sui. Supportive measures. Supportive care is just as important as medications. Provide fluids to combat dehydration. Improve nutritional support for weakened animals. Prevent complications like bacterial enteritis or pneumonia, especially in cold weather, by administering parenteral sulfonamide. Avoid these. One crucial point to remember: corticosteroids are contraindicated in coccidiosis treatment, as they suppress the animal's immune response. Treatment limitations: it's important to note that most chemotherapeutic agents are effective only during the early Schizogony stages. They have little to no impact on the later Gametogony stages of the parasite. Supportive care, fluids for dehydration and proper nutritional management are essential. Control, preventing coccidiosis involves maintaining hygiene in pens, avoiding overcrowding, elevating feed and water sources to minimize fecal contamination, using anticoccidial drugs proactively in high-risk groups. Closing, thank you for watching. Understanding and addressing coccidiosis can make a huge difference in animal health and productivity. Don't forget to like, share, and subscribe for more informative content.